Good evening, everybody, and thank you for tuning in to our latest Ask the Leaders Facebook Live Q&A. Some of you will already know that the Council has held a number of Facebook Live sessions now, covering a range of topics from the latest public health advice to the reopening of the city. This week, I'm really pleased to be able to be joined by representatives from Public Health and Safer Communities to discuss the city's ongoing response. We'll be taking a closer look at public health in York, including the guidance around testing, face coverings, social distancing, and the latest data. Before I go on and let the panel introduce themselves, I'd just like to take a minute to highlight some of the work of our public health teams in the city. Over the last few weeks, we have seen further local restrictions be put in place across the north of England. And as the public health risk remains low in York, thanks must go to the work of residents and businesses keeping each other safe. Such measures, if they were not taking place in York, would have been at risk. Whilst it's good news that the figures remain low, what we have seen in other areas of the country and around the world also shows us that we can't be complacent. Fiona Phillips, our Assistant Director for Public Health, will be able to later provide us with a more detailed update on the current situation in York. However, I'd like to once again thank all residents who have continued to follow public health advice to make sure that progress has been made and is maintained in York. With more shops continuing to open following the easing of government guidance, the response to our Let's Be York campaign has been great, with people enjoying the city in a safe, considerate and responsible way. And it's been good to see people continuing to shop local and support York's range of independent businesses that characterise our city's vibrant local economy. And lastly, you might have seen, and we've also been actively working to see how we can support the centralised track and trace system locally after public health teams have expressed concerns over the current system's lack of efficiency. And I've personally written to the Health Secretary following this, and I'm more than happy to update through our local outbreak board. But I'll stop there and begin to ask the panel to introduce themselves. I should have done that when I started my introduction, but I'm Councillor Keith Aspden. I'm the leader of City of York Council, and I shall pick on people randomly depending on where your boxes appear on my Zoom screen, but maybe not to the public. So I'd like Councillor Carol Runciman to introduce herself, please. Or we'll just have to mute and unmute as we go.
Good evening, everybody. I'm Councillor Carol Runciman. I'm Chair of the City's Health and Wellbeing Board and a member of the Outbreak Management Advisory Group. And my portfolio is adult social care and health.
Thank you very much. Secondly, Fiona Phillips.
Hello, everyone. My name's Fiona Phillips. I'm the Assistant Director of Public Health for the City of York.
Thanks, Fiona. And thirdly, Inspector Andy Godfrey.
Good evening. I'm Andy Godfrey from the local Neighbourhood policing team covering the city centre. Thank you.
Thanks very much. And lastly, but not least, Dr. Andrew Lee.
Hi, good evening, everyone. My name is Andrew Lee. I'm Executive Director of Primary Care at NHS Vale of York CCG.
Thank you, everybody. And just to say thank you very much for our guests joining us and for the time that you're giving on the call today. It's appreciated. So we've had some pre-submitted questions from residents, and I'd like to thank those residents for getting in touch with the council. But I'd also encourage those watching either in its totality or dipping into bits of the Facebook Live to ask questions on Facebook as well. And I will do my best to cover as many questions, the pre-submitted ones and those that residents put forward on Facebook. But first, before we get into the questions, I'd like to give Fiona an opportunity, because this is the sort of public health Facebook Live, to just give us a little bit of a general update as to the latest data and how things are going in York. Fiona.
Thank you. Yeah, so just to run through some of the numbers for people watching. So we have currently had 938 confirmed COVID cases in York. What that means for our population is that for every 100,000 of our population, we have a rate of 445 cases. That compares to, in England, that rate is 489, and in the Yorkshire and Humber region, that's 622. So what that means is that our rate of infection in York is lower than the England rate and quite considerably lower than the Yorkshire and Humber rate. And people will have seen stories in the media about what's happening in other areas of our region. So it's very close to home for us. So we're not complacent about it, but we have had low numbers up until now. What it means on average is that we have around about 4 confirmed cases per week. And when you look at how York as a local authority compares to all of the other local authorities in England, we are ranked as being 57 out of 150 local authorities, whereby one has got the lowest infection rate. We have had, sadly, 162 of York residents have died from COVID-19. And in terms of the track and trace, which was just mentioned, that started at the end of May nationally. In that time, there have been 102 cases have gone through the track and trace programme, and 86 of those have been contacted. And those 86 confirmed cases have led to 192 contacts being identified, of which 123 have been followed up. So we do want to make some improvements to those numbers, and ideally we would be wanting to follow up with everybody who has been in contact with a case so that we make sure and are ensured that they have the relevant advice around self-isolation. So we know obviously as well that the numbers that I've given in terms of the numbers of confirmed cases, we know that there will be more people who are affected by COVID-19 who don't get tested. So we know that a number of people will be asymptomatic. So we know that those numbers are probably not the full picture. And others will be unaware that they've had the infection, and that is why it's those measures such as social distancing, hand washing, face coverings are so important, because whilst everybody wants to do the right thing and isolate when they have COVID, there may be some people who are unaware of it. So hopefully that gives a little bit of a feel for where we are in York at the moment.
Thank you very much, Fiona. And then the first pre-submitted question that we received was asked by Steve, and it was on public health data. So I shall send it back to you as the first question, Fiona, which was, there are concerns that residents aren't being given regular updated local information on some aspects of the pandemic. Some information emerges during meetings, but it's not systematically reported on websites like Open Data. The council has released some results from the Big Conversation survey. Where can the results to date be viewed? Fiona.
Okay, so I'll cover the public health data. So we get various data from various sources, and we do try to make as much of that as is relevant available to the public. So as mentioned, we do every week on a Friday publish the updated data on the York Open Data platform. And then also we have our monthly outbreak management advisory board, whereby we will always start those meetings with an overview of the data, and as well as at the meetings, the papers and all of that detail is published on our website. There's some examples of data. So I think the person asked about bed occupancy and why we don't publish that. So numbers of people in York Hospital who are being treated with COVID. We get those updates now once a week from the hospital, and the numbers are very low. It's not our data, it's York Hospital's data. So we don't publish that routinely, but obviously when we are in those public meetings, we do give an overview about what the situation is within the hospital. Again, care homes, we don't routinely publish the numbers of people in care homes with confirmed COVID, but obviously for our purposes internally, it is something that we are monitoring so that we can support the care homes. Again, and we will talk about that in meetings to give an overview of what's happening across York. And again, it's very low numbers. We have no current cases of COVID in any of our care homes in York. There was questions asked about whether we publish what's known as Pillar 3 and Pillar 4 data, which for those who aren't aware, Pillar 3 and 4 relates to antibody testing, which at the moment is only available for NHS workers. And Pillar 4 data is related to some of the ongoing surveys that are being carried out nationally to monitor rates of COVID across the country. Those Pillar 3 and Pillar 4 are just something that we don't have access to. So as I say, where we do have access to data, we try to be as open and transparent as we can, but there are some levels of data that we just don't receive at a local authority level. So as I say, I think we try to be as transparent as possible, but sometimes we also have to be mindful that we protect confidentiality, because a lot of this is patient level data.
Thank you very much for that. I can see that some questions have started to pop up and come in from Facebook, and although they're not all directly related to the questions we're asking, I'll try and bring them in when I can. And one either for Fiona or Andrew is, will face coverings be required in secondary schools? So slightly different to the one on data. Who would be able to answer that one?
I don't mind coming in on that, because we've done a lot of work with schools to support them for children returning in September. So face coverings won't be mandatory in a secondary school setting, but there will be lots of other measures in place to keep staff and students safe. So they will be operating in smaller cohorts, so there won't be mixing between year groups, or even in some cases between classes within year groups. So they'll be mixing with much fewer number of people than they would normally, and then enforcing social distancing as much as is possible, and then also more opportunity for regular hand washing within the school setting, and provision of alcohol gel and things like that. So not face coverings, but as many other mitigations so that we can get the risk as low as possible.
And I'll bring Andrew in next for any comments to add. And I can see that on Facebook, some other residents have said, are there plans to make densely populated areas in the city mask only zones? So a slightly different angle, but anything to add, Andrew?
Thank you very much, Cal.
Oh, sorry, go on.
Oh, sorry. Is this for me then? Presumably?
Yes, please. Yeah, sorry. I'll try and stick to Andrew and Andy, as otherwise we'll be a complete muddle for the hour.
Okay. The guidance or the advice really with regards to mask use has a fairly simple logic. If you're going to be in a crowded, confined space where you're likely to be in close contact with people, that's where you should be wearing a mask. So rather than trying to be too draconian and specifying, there is a degree of sensibility that we require from residents, really. Yeah. So just remember the 3 C's. If you're going to a crowd, if there's going to be close contact, if it's going to be a confined space, probably a good idea to mask up.
Thank you very much. And Andy.
Just find the unmute button. No, I wasn't going to add a great deal other than to date, I think certainly from our experiences, the residents of York are largely following the face covering restrictions. We certainly get very few reports of them not doing, and my experience from personally being around the city is that people are following the guidelines.
Thank you very much, everybody. The next question that we'd received, which in a sense follows on from that, was from Adam, and it was about local lockdowns. And the question was, who decides if we need to have a local lockdown and what would happen? And would we know very far in advance? So I'm going to ask Fiona to start off on that question about local lockdowns. And then something that I know a lot of residents and businesses have then been talking about across the city is about public safety enforcement, and that broadly, as York begins to get busier again, particularly in the city centre, how we can try and encourage safe social distancing, the wearing of masks and the following of those public health rules. And I'll then ask Andy to come in with any advice from the police. Fiona.
Okay, so a local lockdown is basically when some or all of the protective measures are put back into place in order to control the spread of the virus in a particular area, or it might mean that you delay the easing of some restrictions. So, for example, you might decide that certain businesses now can't open as was nationally planned. And the aim is really about how do we prevent the spread of the infection and do that on a local area basis rather than having to reimpose all of those restrictions across the whole of the country. Probably one of the best known examples was the first of these that happened in Leicester and parts of Leicestershire. And similarly, that's happened in more areas since then. But it's really a kind of data-driven process. So we're continually collecting data in terms of the number of cases. We have something nationally called the Joint Biosecurity Centre, which works with Public Health England and NHS bodies to continually measure that data and look at what's happening across the whole country. And when they feel that certain thresholds or levels are being met, they may make a decision that we need to take action in a certain area. Conversely, it can work the other way as well. So as a public health authority in a local area, if we are picking up intelligence that there are issues or rises in cases that we're worried about that haven't been picked up nationally, or something that we're concerned about that might lead to more cases, we can raise that through Public Health England up to central government as well. And basically what happens is that areas kind of get labelled as either an area of concern, so this might be where cases are going up at a higher than expected rate, so it's kind of on the watch list for something is kind of happening here. They could be designated as areas of enhanced support. So again, cases are going up and there's more resources need putting into that local area. So that might be, for example, putting in a mobile testing site to get more people tested. And then the third sort of designation is you could be classed as an area of intervention. So that's at the point where you're looking at those additional restrictions and closures that might have to be put into place. So in terms of how quickly that can happen, obviously you could get onto one of those 3 designated areas quite quickly. But I guess the hope would be that you would become an area of concern before you kind of work through to being enhanced support and then an intervention needed. So not necessarily an overnight thing, but obviously the whole reason behind putting in place those restrictions is that you do want to act swiftly in order to reverse that trend that you might be seeing in an area. And in terms of what some of those measures might look like, again, it's very sort of data driven. So if we take the example of what's happened in some other areas, the restrictions have been around not being able to meet other households inside of their house. And that was really because the local intelligence from that area led them to believe that it was that kind of social gatherings in people's houses that was leading to the increase in cases. So any measures that do get put into place have to kind of be in response to what's driving a rise in cases.
Thank you, Fiona. And then there was that wider bit about public safety, and also, I guess, feeling confident. Andy. Oh, you're just on mute. I think this will be the Facebook Live known as the one that
I'm not on mute now, hopefully. So throughout COVID, our priority has obviously been to protect the residents of York and help stop the spread of the virus. And to do that, we've had to work within changing government guidance and legislation. When we've had to adapt our ways of working and working with various other agencies and partner agencies within the city. And to do that and to apply it, we followed an approach called the 4 E's approach, and you might hear me mention this again today. But basically, the 4 E's is, first of all, it's engage with people, and obviously try and then educate them if they don't already know about the legislation and the guidance that they should be following, and then encourage them to do so. And it's only really a last attempt, really, if we have to get to the enforcement stage. Now, obviously, the government have given us powers to fine people, but that we don't really want to do that. And I think, certainly my experience, mostly in York, is that people follow the guidance and that we don't have to get to that stage. So that 4 E's approach has worked quite well in York. However, obviously, in the early days, we did give several tickets out, but I think more recently, people are sort of abiding by the legislation and the rules and listening to us when we try and explain.
Thank you very much. Just as a general point to those listening, that if there are particular questions on face coverings, school transport, and a return to school, because we're seeing a few questions on Facebook on those topics, we do have a Facebook Live Q&A on the 25th of August, particularly for school leavers, and on the 2nd of September, particularly for talking about going back to school. So if we don't get a chance today to answer those questions, do come back or put your questions in advance for those next two Facebook Q&As. A supplementary question, Fiona, I'm going to ask you to look at from Facebook is, do you publish or can you say how often there is regular testing in care homes, which obviously has been a very topical issue nationally and in York, Fiona?
Yeah, so I guess the journey sort of with care homes started with very much sort of trying to contain the outbreaks that we had. So our testing policy at that time was very much based around where we had one or more case in a care home. We were then able to deploy testing for the whole site to pick up anyone who wasn't symptomatic and make sure we could contain the spread of that outbreak. As we've kind of moved through now, and as I said, we currently have no care homes with live outbreaks, we're moving to more of a regular testing in care homes, just in terms of that kind of keeping them COVID free. So we're really just starting on that cycle and getting into a regular pattern of that. Nationally, the government announced that they wanted all care home staff to be tested on a weekly basis and all care home residents to be tested every month. So we are looking at how we get into that kind of cycle of doing that, but obviously very much working with the care home sector and obviously the residents as well, because you know, we have to make sure we're doing the right thing for residents. Obviously, we want to keep them COVID free, but we don't want to subject them to unnecessary testing. So it's finding that balance about what's right with the care homes in York.
Thank you very much, Fiona. One of the things that I know residents have spoken to me about from my local community is the topic of shielding. So I'm going to bring that question and ask Carol to answer this, and whether Andrew had anything then to add, particularly in terms of advice that might be given out. But after the government announced that vulnerable people will not have to shield, understandably, residents who might need help might be reluctant or unable to leave their house. So what really help and advice is available to vulnerable people who might prefer, for example, to continue shielding? So I'll go to Carol first on that one, please.
Thank you, Keith. I think it's been very difficult for people who are shielding and their families, and they've had to go through a lot of trouble and thought as to how best to do that. And now shielding is lifted, they're into another situation which gives them a time for thought as to whether they really want to not shield anymore. And I know a lot of them will. We at the council are very aware that the government help has stopped. So the free food, the medicine delivery, the care has stopped, but the council services haven't and won't. And there's been some amazing connections made with people. I know from my own ward, people have connected to help others, and those connections have stayed on. And just being able to talk to somebody to get some support is often what is needed. And then maybe a small amount of help to get some shopping or whatever. We still have a coronavirus helpline, 55155A. 550, sorry, and also an email address which you can ask for help, which is COVID-19 in capital letters, help@york.gov.uk. And if anybody needs help and has access to a phone or to the internet, then I'd suggest they ask for it, because isolation for the people shielding has been a particularly difficult problem. We all need somebody to help us. We all need somebody to talk to us. And we don't want people to feel they're stuck on their own. The council is still here to help. The volunteers are still here to help, and just ask and we'll see what we can do for you.
Thank you very much for that. Andrew.
Thank you. Yes, I'm just going to echo what Carol has said, really. For those who've been shielding, I know that it's been a really worrying few months, and many of you are still concerned about just how safe it is to get out there. A degree of reassurance, you've heard from Fiona that the levels of infection in our city is low at this point in time. We are probably one of the safest places in Yorkshire at this point in time. It doesn't mean we should let our guard down. We should certainly still maintain the hand hygiene, the distancing, and the face coverings, especially when we're out. But it's a degree of reassurance I'd like to offer back to our residents, especially those who are shielding at this point in time. There are services still there. We know that there are lots of local community volunteer initiatives, which is fantastic. That's still out there. And we know that we've also got some of our mental health services that have stepped up and are providing online services, for example. So if anyone's really affected badly, especially if you're shielding, because social isolation can really affect mental health badly, do get in touch. Get in touch with our mental health providers, get in touch with your GP. Yeah, don't suffer in silence. And I guess that's my message I'd like to get across.
Thank you very much for that one. And another one that is currently a couple of people are commenting on Facebook is around track and trace. So I wonder if I could, we're hopping around the different topics, but they are related. And if I could bring Fiona in on that. And really, I know that obviously several councils are looking at what we can do locally to bring in a track and trace system, particularly because of concerns that either the data isn't being or is not being shared quickly enough from councils, and obviously what more we can do to try and keep people as safe as possible. Whether you can update residents on that in York.
Yeah, so I mean, it is a work in progress. So I said the figures at the start in terms of the numbers that the national track and trace service managers to contact. Obviously, we'd like that to be 100%. So we are looking at proposals for how we could work alongside the National Track and Trace programme. We couldn't aim to completely replace it and do without it, because they do a lot of the groundwork. So we want to complement and work alongside the national programme, but make sure that we pick up people who potentially fall through the net. And I suppose, I know that a lot of people, if they get calls on their mobile phones when it's a number that they don't recognise, that they often, maybe feel that they don't want to answer that because it's, perhaps somebody who's just ringing to try and sell something to them. The National Track and Trace calls always come from an 0300 number. So I guess if people are receiving a call from a number starting like that, it would be good if people did pick up the phone and take part in that initiative, because it does mean that we can then it can be worked out who you've had contact with, and we can get the advice to them to self-isolate, and it just means that we prevent any big outbreaks happening. So it is really important, but certainly we are looking at how do we complement that programme, and that will be in terms of how our public health team can recruit more resource within to our public health team, and also within our environmental health team in the council, who, as many people will know, have got those skills in terms of how they work in terms of outbreaks of foodborne illnesses. So we are looking at what resource we can recruit into the team using the money that we were given from central government to back up our outbreak control plan.
Thank you very much on that one. So I'll take us back now to our pre-submitted questions, and a question that was asked by Angela, and I think this one I'm going to ask Fiona and Andy to comment on initially, which is I'd like to ask why taxi drivers from areas outside York, particularly those where lockdown restrictions had to be reinforced, are allowed to operate in York. Surely this is putting York at risk of the virus being spread from these areas. So if I go to Fiona first, to check in on that one, Fiona.
Yeah, so as I said to one of the previous questions, the lockdown measures in some of our neighbouring areas are really focusing about the social gatherings people have, particularly inside houses, and that's what the restrictions relate to. So for people who live in those areas, there is no restriction in terms of travelling outside of your area of residence, whether that's for sort of visiting family or for work purposes. So people are well entitled to come into York for work reasons, and we can't sort of stop that. In terms of specific measures that companies put in place, for example, taxi drivers, they're obviously following the COVID secure guidelines in terms of making sure that they operate in a safe way. So, for example, offering hand sanitizer to passengers, requiring that passengers sit in the back seats, other measures like screens, having open windows. So it's more about the measures that they put in place to make sure that they're following safe work guidelines.
Thank you very much. Andy, anything to add?
I think Fiona's covered most of it, to be fair. Obviously, the police can only act within the government guidelines, and we can't stop people from either delivering or coming to places of work that are not in their local residence. So, yeah, that's what we have to sort of follow the guidance.
Thank you. One thing I could add is that I know that two of my colleagues, councillors Denise Craghill and Ashley Mason, have written to the Home Office, particularly on that point, seeking confirmed guidance or clarification from the Home Office on how the guidance applies to those working across areas subject to different levels of restriction. And I'm sure when we get a response back from the Home Office, we'll make sure it's published on the council's website, and particularly for those in the trade that understandably will have questions, I'll make sure that gets done. Moving on to the next question, which was all about reopening offices and workspaces, and this was by Esther, who sent this question in advance. And it's a sort of two-part question, so bear with me. Which was, in order to protect the mental health of employees and to encourage spend of money at businesses, especially retail and food and drink in the city, does the council think it is high time that efforts were made to facilitate a return to work by individuals for, say, 1 day a week to access the facilities and gain some sense of normality or sanity? And do you think that now is the time to make physical and tangible efforts to arrive at a reasonable balance between complete isolation and some degree of normal working and spending practice, especially when the numbers of transmissions are low in York? So I think I'll give that one probably first to Fiona, but welcome anybody else that wants to come in, raise their hands and make a contribution. Fiona.
Yeah, so I mean, I guess all organisations across York and other cities across the country are all looking at the government guidance and making decisions about what is best for their staff. Certainly in York, we've worked with a lot of organisations to give them advice about how they carry out their workplace risk assessments so that they can make sure, if they are welcoming staff back into offices, for example, that they can do that safely. I mean, obviously, I can only speak for us in the council in terms of some of the work we've done for our staff. So obviously, we've gone through that same process of following the COVID secure guidelines. And from our point of view, it does mean that if we put all of those measures in place for our buildings, we don't have as much capacity as we had prior to COVID. So it's not as simple as being able to say everybody can come back into work, because we just wouldn't have the capacity within buildings, and other businesses will be finding the same thing as well. So, you know, and some organisations and individuals will feel that working from home has given them other benefits, whether that's in terms of a kind of work-life balance or being able to manage caring responsibilities. So I guess every organisation has to have those conversations with their staff and work out what's right for them, what the benefits are of home working, or what the benefits are of coming back into an office space. Again, just speaking for us as an organisation in the council, certainly the issue of the impact on mental health is really important for us. And, you know, thinking about where we are now coming towards the end of the summer, it's, you know, it is certainly a very different prospect working at home through the summer months to working at home, particularly if you're living alone, throughout the sort of long, dark winter days. So certainly we have had those conversations with our staff around people who, for their mental well-being, feel that they would benefit from being back in a work environment, that we look to facilitate that and give those staff priority. So, you know, and I hope that other organisations across the city will be taking a similar approach to that. In terms of the city's economy, I mean, I guess, you know, there will be businesses that have previously benefited from lunchtime trade, for example, from office workers. But also we do know that in normal times, 2/3 of the people who are in the city centre have come from outside of York. They're not office workers. So I think it is just sort of getting that balance right, really. And as I say, organisations determining what's the best thing for them to do.
Thank you very much for that. Andrew, I don't know if there's anything you wanted to add to that, but unrelated, I can see that a question's come in on Facebook, which I think you'd be best placed, which is that if infection rates are low, why are there no elective surgeries taking place in York districts? I know that's a completely different topic, but if you had any comments on that first one and the second one, that'd be appreciated.
No problems. Let me go straight to the elective surgeries bit. Firstly, elective surgery is taking place, but not at the levels pre-COVID that we had pre-COVID. It's been really, really tricky for our hospital, and I have a lot of sympathy for our hospital. because you've had to convert a lot of the pre-operations space into potential intensive care areas, and they've had to move staff around the place in case there was a huge need for a lot of intensive care place, essentially. So people are in the wrong place, equipment's in the wrong place, and it's affecting the function of the hospital. It is very difficult for them to revert back to a pre-COVID state because they need to maintain the ability to respond to a surge. We are by no means out of the pandemic, and currently we're doing a lot of preparations and planning in case there is a winter surge. And that means having to maintain a degree of ability to respond to surge. Now, this is scant comfort to a lot of residents who I know might have had appointments cancelled, they're awaiting procedures, awaiting tests. But can I reassure you that the NHS, we're really trying really hard to try and get a lot of our services back up and running as close to pre-COVID levels as we can. But please bear with us, please understand that we can't get back to 100%, not in the short term anyway, because we've got to maintain the ability to respond to a surge. So that's the first bit. And just to follow up, the last bit was, if the levels are low, why can't people get back to work? Exactly as Fiona has mentioned, every organization has had to make a risk assessment as to whether they can open safely, and where staff can continue to work from home effectively and safely, then we should be advocating for that. Lots of benefits for doing that, including reducing the impact on the environment, for example. But there will be some work settings where people will want to come back. And if it's safe to do so, that's entirely at the discretion and judgment of the employer, I would have thought.
Thank you very much. And I know I can add to, obviously I know a lot of businesses, not just in York City Centre, but in our secondary shopping areas in Acomb and Haxby and out of town, have made huge efforts to get their businesses prepared, and that's that Let's Be York campaign that I mentioned before, where we're seeing new pop-up spaces. So for example, in partnership with the Business Improvement District on College Green near the Minster, with more to come, so that people can gradually feel more confident, for example, eating, drinking or buying something in the city centre, but that they can remain outside, and that obviously when they're in shops, I know different businesses are doing everything they can to build that confidence back up, whilst we have that balance to people gradually returning to offices, either because their job's essential or now because it's in their interest in terms of their mental health, is going to be a very important gradual return back to offices and to the city centre. But the flip of that is that we also want to see those benefits in terms of walking and cycling, people spending more time at home and with their families, being locked in after this, and learning from that in terms of how you can work differently while supporting your local businesses. And that's always going to be a really tricky juggling act moving forward. But going on to the next question, otherwise we could probably spend all the time on that last one, is about disbanding Public Health England. So it's a very topical question, as there was speculation last week that the Health Secretary might do it, but the government has now confirmed that. And the question that we've had from Rachel is, how will the proposed disbanding of Public Health England affect the public health team in York? And considering that York has one of the first publicised and contained incidents of the virus, how will the disbanding of Public Health England affect York's efforts in tracking and tracing contacts? And I think this one I'm going to go first to Andrew, and then I'll see if Fiona's got anything to add.
Thank you. Well, personally, I'm deeply saddened by the news that PHE is being disbanded. So I'd like to start by paying tribute to the 5,500 doctors, nurses, data analysts, scientists who work for the organization and have certainly supported our local authority and CCG over the years. In terms of how it will affect our local public health team, in a way, the situation now is much better than it was back in February. We're in a much stronger place. We've got an outbreak management advisory group, a local health protection board, procedures in place that our local authority public health team have worked very hard to get up and running. So one legacy, I guess, from the close working between Public Health England and the local authority in the last 6 months is that we have strengthened locally the ability to respond and to monitor the disease in York. The second bit is with regards to what about all the data, the testing and track and tracing. I guess we are all waiting to see what the changes mean. But from what I can see, from what we've read from the DHSC websites, is that initially, at least, the intention is for a lot of the ongoing work and infrastructure to remain very much in place. There's also an aspiration for there to be local health protection teams from the National Institute for Health Protection. So in some senses, while PHE might have been disbanded, a lot of the functions will continue because the need is still there, the work is still there. And the last reflection I would like to share with you is that I have a lot of confidence in the public health team in York. Many of them will have been trained and spent time in the predecessor organization, the Health Protection Agency, or indeed Public Health England. So York, you're in a good place, you've got good people here, and there are systems that have been built up in place. So I feel reasonably confident that that we can deal with whatever comes up.
Thank you very much. Fiona, I don't know if you've got anything to add, and of course the fact that Public Health England is a national body as opposed to the public health team in York, and that it won't affect that arrangement.
Yeah, I mean, I suppose I just, echo what Andrew said in terms of, thoughts for the staff who work in Public Health England. We work very closely with colleagues in Public Health England, and, to wake up on a Sunday and read some of that stuff in the press, I can only imagine how that must have felt for them. I mean, I won't repeat what Andrew has said, but I suppose just the other bit that I would pick up is, a lot of the announcements at the moment around this change are in relation to COVID-19 as a health protection issue. But what people may not realise is that we work very closely with Public Health England and rely on support from those colleagues around a plethora of public health issues in York, whether that's obesity, smoking, alcohol, all kinds of topics. And, having that support from them is really helpful for our work, so that, you don't get every local authority trying to, work out how do you tackle an issue. It's that kind of shared approach to tackling some of the biggest public health issues that are facing our population at the moment. So I'm very much looking forward to hearing a bit more from nationally about what the plans are for some of those other broader areas of public health work.
Thank you very much. And something obviously you can't say is that my instinct is that the abolition of Public Health England probably has more to do with distraction on some of those national issues than it necessarily does about how Public Health England functioned. And I know that politically, obviously, we'll be making representations to make sure that ministers truly understand how they expect all of the different functions and work of Public Health England to be carried on and out. Because now doesn't strike me as a very clever time to get rid of an organisation like that without that really detailed planning in place. But certainly we'll add it to the list of things that through, I know, Public Health England colleagues, but also politically, we'll make sure that message gets passed back up the chain. Carol.
Quick comment, Keith. There's been a tremendous amount of team working going on during the pandemic, right across from the government departments down. I would hate to see that disbanded. We've worked really closely with the CCG in all its various levels. We've worked closely with Public Health England. And like you, I feel this is the wrong time to change. But whatever happens, that close working has to continue. Because as Andrew says, the pandemic hasn't gone away yet. And we need to continue to be very careful to make sure it doesn't get a hold. So I hope whatever follows on from Public Health England will be established fairly quickly so we can build and maintain on those relationships we've already got.
Thank you very much. I think in terms of time, we've probably got time for one more question. And one of the things that different residents have been talking about is about lifestyle changes that might improve health. And I'll send this one to Andrew's way first. And there's been a recent campaign from the NHS highlighting, for example, the increased danger that smoking can present. What are the lifestyle changes that people can make to make sure that the virus would not cause complications or pose a serious risk to health?
Thank you, Councillor Aspden. So what we do know is that the people who have got comorbidities, that means other illnesses like hypertension and obesity, are much more likely to have a worse outcome from COVID. So the best thing everyone can do is try to be as healthy as you can. And it includes stopping harmful habits, be it smoking, or putting our fitness, our physical activity levels at its very best. Now is a good time as any to stop smoking. Now is a good time as any to start increasing our physical activity levels and being careful about what we eat. We were just talking about PHE. PHE has got a good app, the Couch to 5K app. So for those of you who want to get back into running and getting fit again, there are resources out there. And I know York as a city is a fabulous place to be physically active compared to a lot of other cities in region. So I would encourage residents, take advantage of that. You know, there's lots of activities on the doorstep, so you don't have to go far, and make use of that. Thank you.
This is when I forget to mute. It won't help, but thank you very much for that. I'm going to squeeze an extra question in, and then I'm going to go to you, Fiona, anyway. So if I say what the extra question is, and then you can see if you can do both. But a couple of people have asked on Facebook around how the city will manage the return of university students, with both the University of York and York St John students returning in September and October. And I know an awful lot of work has been going on with that, but if you could pick that up as well, Fiona, that would be appreciated.
Yeah, I just, on the back of what Andrew was saying, I just wanted to unashamedly give a plug to our health trainer service in York. So if there are any residents out there who are thinking, yes, I could do with being a bit fitter, whether that's doing a bit more exercise, eating a better diet, losing a bit of weight, stopping smoking, whatever it is, whatever health issue you're struggling with, if you want some support with it, York 553377. That's a phone number for our health trainers. They can work with you. It's not a kind of, they're not telling you off. They're not, gonna, tell you how bad your lifestyle is. What they're there for is to kind of look at what it is that you want to achieve, what will make you feel healthier, and then they'll work with you to help you achieve your health goals. So you can call them on that number, or CYC health trainers at york.gov.uk. They're kind of there, and they can do that virtually over the phone on video link, or we are getting back with some socially distanced face-to-face support as well. But on the topic of the universities and the colleges, so yes, we're working with all of the 4 higher education and further education institutions in York. We're doing that across a number of areas. So first of all, it's about how do they make their sites safe, and so following all that guidance in terms of social distancing, hand sanitizing, how do they make their buildings and sites work to have students back in. And they are looking at kind of a mixture, blended learning, so some online work, some face-to-face in smaller group work. So they're working out all of that with support from public health to get that right. That's one aspect of it. We are then also looking at how do we work with the students when they're back, so that we make sure that they are informed about what they need to do, so that they know to follow that government advice, and they know what to do and how to get tested if they have symptoms. On the testing element, so people will know that our drive-through site is over in Poppleton Bar, and as you can imagine, you know, a lot of our students won't drive, and particularly for the University of York students who are kind of over on the other side of town, that creates some challenges. So we're working to look at how we can make access to testing for students as easy as possible via the universities or colleges, so that they don't have to travel if they can't do that. So yeah, so quite a lot of work going on, but you know, the students are an important part of our city, so we're looking forward to welcoming them back, and we will look to do that in a safe way.
Very much. And Andrew, you wanted to come in on that?
Yes, please. Just two final thoughts from me. The first is about face coverings and hand sanitization and all that. We've got to make it a norm. Everyone's got to do it, and if we all do it, and it's normal, when the students return, they will see it's the norm for the city of York, and that's how we protect everyone, and not just the students or the residents. And the second point I'd like to make is about flu. We need to get as many people who are eligible for flu jabs this year immunized. And because what we don't want is a flu outbreak and a COVID outbreak coming together. That's just bad news. Yeah. So if there's one thing everyone can do who's eligible for it come the autumn, please get your flu jabs. Thank you.
Thank you very much for that. And with an eye on time, I'm going to have to start wrapping this up. And I'd just like to say thank you very much to everybody who either sent us a question or asked us a question on Facebook or got involved in a discussion on Facebook. It's really valuable for all of us on this call to hear your views. And I know that we'll continue to hold Facebook Live Q&As, as just mentioned, two coming up for school leavers and returning to school. I'd also like to thank our panelists again for their time and insight. Carol, Fiona, Andy and Andrew, much appreciated, and as I'm sure agreed by everybody watching the call online. And before we go, just a final reminder that residents and businesses can still share their views on the council's recovery work and the future of York through the big conversation, and that can be done online or through the Our City magazine that will be going out to all households. So please do continue to get involved. I hope you've enjoyed this week. The next session is on Tuesday, the 25th of August, which will be focused on next steps for school and college leavers in the city. But you can continue to leave your comments and questions on the Facebook Live page, and members of our communications team will try and get back to you within the next 24 hours. So as a final word, just to say thank you all for joining us tonight, and have a great rest of the evening. Thanks all. Bye-bye.
Bye-bye.